Yes, ma'am.
That is good
Yes,
to know.
ma'am.
So you guys have 3 minutes to just read this card, and then we'll be doing your speaking. Okay? All right. This is a card.
Okay,
You
ma'am.
got the setting. Just need the card, and then we'll begin in 3 minutes. All right, so the 3 minutes time is almost up. The almost up. Who's got their exam tomorrow? Dr. Zeshan, I think your exam's tomorrow, right? Dr. Zeshan, and
Yes, ma'am.
who else has their exam tomorrow? Just you? Mm-hmm. Okay, so we're gonna start with you. Okay, so I'm gonna put a timer of 5 minutes, and that's when you start speaking. Okay, all right, Dr. Zeshan?
Okay, ma'am.
Okay, give me just a minute, and then we're gonna begin. Okay. Okay, your time starts now. Go.
Good afternoon. I am Dr. Zeshan. May I verify your name and age?
Yes, doctor. My name is John, and I'm 50 years old.
John, as I can see my notes that recently you have been diagnosed with Parkinson disease. So would you like to tell me about your disease? How's your feeling after taking medicine?
Well,
Is
you
this
know, I've been taking this medication for a long time. And I think that I'm doing okay, but you know, like my muscle spasms have gone away, but I can still not swing my arms. But I don't have any tremors. You know, let me just tell you, doctor, that you know, I just don't like taking medications, and I just don't want to take this medication anymore. Yeah.
uh, I can see that you are worried regarding your disease, and it's very difficult period. And take medicine is always difficult. So,
Mm.
as you have diagnosed with Parkinson disease, so I will highly recommend it you that please continue your medicine as it is
Mhm.
very necessary to continue your medicine. Are you following me, Mr. John?
Yes, doctor, I am following you. But doctor, the thing is, I don't understand what Parkinson's is and what causes it. So I just don't know. Why is it necessary for me to take the medication?
I am here to help you out. I will help you regarding this disease. Let me explain for you. Parkinson disease is a degenerative disorder of our central nervous system. Like there is deficiency in our brain. So due to this disorder, multiple things happen. Like there might be the motor skills problem, there might be problem of speech and some other functions. I hope, Mr. John, you are following me.
Yes, doctor, I am following you, but I still don't understand. Why did I get this disease?
Just now I explained about Parkinson disease. Now I would like to discuss about the causes. And let me tell you that there are multiple causes. Right on the top, one of cause that is the head trauma, and there are other causes like exposure to any toxin and some other simply unknown causes. So, beside these medicine, I would highly recommend you that first of all you need to continue your medicine, and besides with these medication, I will highly recommend you please take some physiotherapy session. I hope I'm making myself clear, Mr. John.
Yes, doctor, you are making it very clear for me, but I don't want
And
to try medication. I don't want medication. I want to go for something other than that. For example, you know, some acupuncture, some exercise, or some massage. That's what I want to do.
I can see that, Mr. John, you are frustrated because of your medicine, and it is very difficult to continue the medicine. Always taking medicine is difficult. I can understand. I really appreciate your concern. So there are multiple options that are available beside these medicine. Like I told you, physiotherapy, it could help your movement, your pain, and breathing pattern. And beside these, there are some benefits of the exercise, acupuncture, massage, and these are the alternative. These are not alternatives of the medication. These therapies will help you to improve your sign and symptoms. But I'm so really sorry to tell you about this that you have to continue your medicine, and these medicine will help you a lot. And other things that I told, like exercise, like physiotherapy, acupuncture, massage, these will help you beside the medicine. I hope you are following, Mr. John.
But doctor, like I do have to really take the medication. Is that what you're trying to say?
Yes, you must carry your medicine. And anything else you want to ask?
No, this is all that I wanted to know. Thank you so much for helping me today, doctor.
Thank you so much. As you have my number, you can call me anytime regarding your disease. I
Okay.
will
All
feel
right. All right.
happy
All
if I
right.
could help
Okay.
you.
Okay, Dr.
Thank you so
Zeshan, the
much.
time's up. The time's up. All right. Have you
Thank
practiced before, Dr. Zeshan?
Yes, ma'am.
Which is good. It was good. It was almost very good. You did very smoothly go on to this. Now, here's the thing. Here's the thing. Now, there are certain things that you did, and that's what we want to work about. The first thing that you did was that you did not tell us about where's the setting, right? Now, even though it says suburban clinic, why do I want you to take the name? Because, you know, then you wouldn't forget. There could be a different setting. You could be in a surgery. You could be in a factory. You could be in a school. You could be anywhere. So do take the name of your setting, right? Like, good morning. This is Dr. Zeshan, one of the junior doctors here in the suburban clinic. May I please confirm your name and age, right? That is good. That's very important. Then, you know, your thing was that you were good with empathy, right? Like you were saying, I understand your concern. I know this is your problem. I'm here for helping you. And, you know, I can help you. Then when you were explaining the thing, right, make sure you listen to the person, even though our job is to respond as well, but listen to the person. I told you that, doctor, you know, I want to know about what this disease is and what causes it. Now you didn't listen to that word. You didn't listen to what causes it, right? So this is why you said the causes as thing, right? Like the third task, you said it separately and you made me talk one more time, right? So what I'm trying to tell you here is that be very active and listen, right? Like you see, you got 3 minutes. You got 3 minutes to do your card, right? Right? You've got 3 minutes to do your card. Okay, 3 minutes to do your card. Now in those 3 minutes, now you don't have to worry about asking the patient's name, right? Like you're not going to be like, first of all, we don't know what kind of examiner there is going to be, the interlocutor is going to be. What if the interlocutor is not cooperative and he wastes your 3 minutes by saying, okay, you can call me John, or you can call me whatever works for you. 1 minute gone there in that conversation. He started the timer, right? He's not there to help you out during that time. So I don't recommend asking name prior to that, right? That's number one. Secondly, in this 3 minutes time,
start?
Mm-hmm.
So, ma'am,
you started in the way.
Okay.
See, what I recommend is just create one introduction and stick with this throughout your exam. You don't have to keep on changing your introduction. You could say, oh, take your name, see, greet, very important to make sure that you greet according to the time, right? Because they're going to record, this is the time, this when this candidate is taking the exam, right? So make sure that you know the time and you respond good evening, good afternoon, good morning, right? Then you have to confirm your name, your identity, right? Your identity is what, who you are and where you work, right? Dr. Zeshan, can you hear me?
Yes, ma'am.
Any questions so far? Any questions so far?
No, clear.
That is good. That is good. After that, you're going to take the name of the person, right? And instead of saying that, you know, what may I call you and all that, how about you say, may I verify your name? May I confirm your name and age? That is it. That should be your introduction for all the cards. That's what I teach any candidate who comes to me. Okay, that's going to be your bit about that. After that, you know, you need to make sure that you tell them that I have read the card, right? Like you said, I can see from my notes that you have come here. You were taking this L-DOPA. You never mentioned L-DOPA, right? Kind of mention that, right? You were, I prescribed you L-DOPA. How are you doing today? You did good, right? Your starting was good. You encouraged, like you see now, your first words: encourage, explain, recommend, answer questions. This is your cue to doing the task, right? Like it says encourage. This means that in this whole task, you're going to encourage the patient. As you said that, you know, it's very necessary that you take the medication, right? And as here you said that, let me recommend you physiotherapy. Now, recommending and forcing is another thing. Don't force the patient. And, you know, like there was a point where I asked you again, and then you said, as I told you earlier. Now, this shows that you're annoyed by the patient. When you say, as I told you earlier, right, that it means that you're annoyed by the patient's questioning, which we're not, right? We're happy to help. All right, Dr. Zeshan. So don't say, as I told you earlier, or as I mentioned before. No. That doesn't sound good. That doesn't sound good, right? Like you said, like I told you. No. You can repeat it. You can repeat it. Yeah, because otherwise it sounds that you're not very happy with the patient and you just want to make sure that he goes away, right? And don't say, as I just explained now, then you said, am I making myself clear? Even though your tone was very good, but make sure that the sentences that you use, those are on the side where it's more polite, right? Like, I hope I'm making myself clear. I hope this answers your query. I believe that I have helped you, right? Just in there. And then you use the word frustrated. How about I call you frustrated? If I say, Dr. Zeshan, you know, your exam is around and you're very frustrated, it doesn't sound like a good word, right? It's almost like calling the patient crazy,
bad tone,
right? So
Yes,
don't say frustrated. You could say, I can see you're worried. I can see you're
worried.
distressed. I can see you're concerned. There are so many words to that, right? Find a thesaurus and you'd get the answers right there, right? So make sure that you
Okay.
are not making the patient go through the roller coaster of emotions because, you use some words which weren't very good, right, Dr. Zeshan? Clear?
Thank you. Yes, ma'am.
Okay. All right. Who else has their exam tomorrow? Dr. Moaz, that's you? And Dr. Mubashir, I can see you. Do you have your exam tomorrow? Okay. All right.
I have.
Yes, ma'am.
Yours, Dr. Mubashir, your exam's also tomorrow?
Yes, ma'am.
Okay, all right. After Dr. Moaz, we'd give you a chance, all right? Okay. All right, Dr. Moaz, now I'm going to give you a card. You would have 3 minutes to prepare that, and then we'd see how you did, okay? Just give me a minute. Let me select one. Like you've done some cards with me, but I just want to make sure that you do more than that, yeah? Just a minute,
Okay.
please. Right, this is your card. You've got 3 minutes to prepare it. All right, Dr. Moaz, the time has started. You've got 3 minutes to prepare it. All right, Dr. Moaz, have you prepared it?
Yes, madam.
Should we start?
Yes, madam.
Okay, let's go. Your time starts now.
Good evening. I am Dr. Moaz Sarwar. I am one of the doctor here at emergency department. May I verify your and your son's name and age?
Yes, doctor, my name is Sarah and my son's name is John and he's 4 years old.
So, Miss Sarah, how is your son feeling now?
Well, doctor, I'm really worried about him. I mean, I saw him and, like he had vomiting 36 hours ago. And, I'm just worried if he's going to be okay.
Yes, Miss Sarah, I can see that you are worried. I can see from my notes that he's been admitted for like last 12 hours and he's been given oral rehydration fluids and he's doing okay from last 2 hours. So we are planning to discharge him. Are you following me?
Yes, doctor, I am following you, but doctor, like, I mean, what did he have actually? I just don't understand what he had and what was the condition and like what happened to him.
Yes, Miss Sarah, I can see that you are worried about your son. Your son got viral gastroenteritis. Are you familiar with this term?
No, doctor.
It's irritation of stomach or intestine due to infection with virus. Is that making sense?
Okay, all right. Okay, all right. Doctor, like, is that the reason he had this vomiting and diarrhea?
Yes, Miss Sarah, this is the reason he had this vomiting and diarrhea. Viral diseases usually do not require any antibiotics or any other treatment. It usually go away on its own. I hope I am making you understand.
Well, yes, doctor, you are making me understand, but the thing is that I'm really worried. Like, if I take him home, do you think he's going to be safe there? Do you think he's going to recover well? Because I can see that he looks really weak.
Yes, Miss Sarah, I can see that you are worried again about your son, but oral rehydration therapy is very effective because he is doing good from last 2 hours and he doesn't require hospitalization. So we think that we believe that he is good to go home. I hope this clears your worries.
Yes, doctor. Well, doctor, what if this happens again?
Miss Sarah, you don't, I hope I can see that you are confused, but we are here to help you. If we want you to take him home and observe him for next few hours or day, if he gets dehydrated again, you should observe his heartbeat, his breathing pattern, his pulse. Then you can bring him back here. I
Okay,
hope
doctor. Thank you
this.
for saying this. Yes, doctor. Thank you for saying this.
Well, thank you for the visit, Miss Sarah. Is there
You
anything
still
else
have a
you
minute.
want?
You still have a minute.
So, Miss Sarah, do you want me to recap what just I told you?
Yes, doctor. Please go ahead.
So, Miss Sarah, you were here because of your son, because he was having recurrent vomiting and stomach pain from 36 hours. We treated him in the hospital with oral rehydration fluids, and he responded to them well. So we are discharging him with the advices of keeping an eye on him for next day, and this is all.
Okay, doctor. Thank you so much for helping me out today.
Well, Miss Sarah, we are here to help you out. Here's my card
Okay.
if
All
you
right.
have
All right.
anything else.
The time's up, Dr. Moss, the time's up. Now, again, you see, the thing is, you did good. First of all, overall, it was good. Just you need to know a few things. Number one, stay confident, right? That's what we've been doing in our classes, right? Make sure you're confident, right? No need to worry. This is not a big deal, all right? This is not a big exam. It's not going to kill you, right? They're not killing you. The person in front of you is not marking you. You're the boss when you sit in that room. Okay, when you sit in the room, think like you're a real doctor. Think like that person is a real patient. Are you ever afraid of the patient? No, it shows from your speaking that you were afraid of the person. You don't have to. All right, Dr. Mas. Like, even when you're talking to me, think like I'm nobody. All right, Dr. Mas. Is it clear? Be confident. That's number one. Can you hear me, Dr. Mas?
Yes, madam.
Okay, that's number one. Secondly, you see, they've given you, they're not idiots, right? Now, how many tasks are here, guys? How many
3,
tasks are here? 3. And how much time do we have?
5 minutes.
Now, do you think you can do this task in 1 minute, this in 1 minute, this in 1 minute? Yeah, right?
Yes.
Almost 1 minute. What about the 2 minutes? You need to see how to divide your time. So here you would take this into consideration and try make a history out of this. How you'd be saying, I can see from my notes, that your son was here in the emergency department, right? He's 4 years old, and you said that he had 12-hour vomiting. No, 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 no. You can't invent things on your own. You have to see and look at the card. It says 36 hours, right? Right, Dr. Mas, you're with me?
Yes.
And see
Yes,
how I'm
madam.
involving you. See how I'm involving you. I can for sure just keep on talking, can't I? I can, right? But you have to be involved. You have to involve the patient, right? Then you can say, like I can see from my notes that he was here 36 hours ago with recurrent vomiting and stomach pain. How is he doing right now? She'll say, I'm worried. I don't know what this is. You'd say, yeah, we found out that his vomiting. You told us that his vomiting was not bile stain. It had no blood. It was clear. And you told us that he was not able to keep anything down, and we thought, and this is why we thought it's viral gastroenteritis, right? You need to tell them that. You need to tell basically the examiner, the person who is taking your exam, that I've read the card. Why are they giving you this whole thing? Your tasks are these, right? These are your tasks. This is your tasks. Why do they give you this? They want to make sure that you've read the card, right? They want to make sure that you've read the card. So if you read the card, you would make sure you would talk about this, right? Now you need to divide time. If here were 6 tasks, you wouldn't talk about this at all. You would just move to the tasks. You'd maybe combine one or two together. Are you with me, Dr. Moss? Are you following?
Yes, madam.
Right? Sorry, okay, then you're going to say that
Okay.
he was here, we gave him oral rehydration, observed him for 2 hours, and now he's good to go home. You did that. That was good. Now don't give them fake information, right? He was here for 36 hours. What if she says, no, he was here for 36 hours? How you're saying it's 12 hours? You don't even know about my daughter or my son. They can do that, right? First of all, they wouldn't. But what about in their card is written that get angry, right? How would you deal with that? Right? So be very sure of the words that you're saying, okay? And then like you have to tell them that this is the reason. Now she told you what's viral gastro, she asked you what's viral gastroenteritis, right? You explained it to them that it's an irritation of the stomach, intestine, because of which they had this vomiting, they had this diarrhea or the stomach pain, whatever it was, right? So correlated for that, right? When you explain someone the diagnosis, there are 3 things that you do. Or when you're talking to the patient in management, now this is management essentially. There are 3 things that you do, which I call RCR. Now this is very last minute to tell you, but I hope it just kind of makes sense. Number 1, recommend, right? I want you to take him home. C, take consent. Do you think it's okay with you, right? R, give them a reason. Why? Because they're good to go home. Do you understand that? So recommend, take consent, and give a reason. All right, Dr. Moss, is that clear? Okay, like
Okay,
give them
madam.
the reason and interact with them. Why do we keep the C part, consent part? Because we want to make sure that we're involving them. All right. Okay. Then you said that yes, miss. I've told you, don't respond reactionary. Don't say yes directly. You need to make sure you don't say yes, no, because in the beginning you have to start by saying something, which is a big sentence or whatever. It should be empathetic, or maybe you could repeat what she said. Right? I said that I'm worried about my son. You would say, I can see you're worried about your son, right? I can see you're distressed. All right. Okay. And then you said, I hope I'm making you understand. Right now, that just seems like you're threatening her. We're not threatening her. All right, Dr. Moss? Okay, be simple
Okay,
about
madam.
it. Are you there? You could just, can you say something? Can you tell me something else instead of saying making me understand? I hope I'm making you understand. What else can
I
you
hope
say?
I hope you
Mhm.
are following me.
Yes,
I
apart
hope
from
you are
that.
understanding.
Okay. One more.
I I
Mhm.
understand what you are going through.
Okay. But how do you make it into a question?
I hope you are understanding.
You said that. I need one more, 2 more. You know this. I know you know. Come on, say it. Yeah, anything.
I hope you are. Can you do
Clear
that
about
for
it.
me?
Yeah, can
Clear
you do
about
that
it,
for
yes.
me? Can you do that for me? Good. Can you do that for me? Are you clear about that? Anything else, Dr. Moss? Is there anything else you could say too?
I hope this clears your confusions.
Good. Anything else? One more? Just one more? You know it all, right? Like, I don't have to feed this to you. You already know this. You're a doctor, mashallah, right? You guys have done it all, right? Don't worry if it's English. It's not a big deal. You guys have read your books in English. You've done everything in English. You just need to stay confident. All right, Dr. Moss? Your English is good, by the way. Okay, I've told you again this morning as well, yeah? Okay?
Yes, madam.
All right, and make sure you don't repeat the same thing. Now, when you are even giving them the recap, right now you said, is it all right if we recap this? It just seems like you're talking about a show, right? Like, you need to watch the recap. No. You could say, how about we go through this again, right? How about we go through this again? Now, recap is not bad. You can use that word, but like, it doesn't sound so good. Okay. So, like, can you recap it for me? It's better to say, how about we discuss this again? How about I explain it to you again? Right. So the patient would be like, okay, now you see, they're not going to say no because they're paid to talk to you and they're paid to say yes. All right. They're paid to be nice to you. All right, Dr. Moss. Okay. Then,
Okay,
like,
madam.
see, I said that, what if this happens again? Now you're a doctor. If somebody has to go through gastroenteritis, they should come back to you. Use your medical knowledge, respond in English, stay confident, give empathy, you're done. That's it. All right, Dr. Moss?
Okay,
Okay.
madam.
All right, don't worry. See, your tone is again low. I don't like that. I'm gonna make you do the card again if you talk like that. Good to go?
Okay, madam. Yes, madam.
Yeah. Good to know. Good to know. All right. Okay, Dr. Mubashir, are you there?
Yes, ma'am.
If you still are, I
Yes,
can see you. Okay, that is good to know.
yes,
That is
ma'am.
good to know. Okay, this next card is for you. Let's see if you can do this. Have you done speaking before, Dr. Mubashir?
I have made some session with my colleague.
That is good. That is good. Okay. Mhm. So let me just give you one card. Okay, this is the one that I want you to do. You've got 3 minutes on the clock, Dr. Mubashir. Let me know when you are ready. All right, your time starts now. You've got 3 minutes, okay?
Okay.
All right, the time's up. Should we start? Let's begin. All right, Dr. Mubashir?
Yes, ma'am.
Okay, go ahead.
Hi, I'm your attending doctor today here at the clinic. Can I know your name, please?
Yes, doctor, my name is Dan and I'm 50 years old.
Okay. I'm Dr. Mubashir, by the way. Okay. So, can you please tell me that what thing made you come here?
Well, doctor, the thing is that, my daughter, she is going to have a baby, and she has done some research, and she says that, I need to get vaccinated for Boostrix. And I've got to know that, this, she says it's a fatal thing and I should get myself vaccinated. I don't really know, doctor. Do you think it's really necessary for me to get vaccinated?
Okay, let me tell you something about that vaccine. And do you know that what is the booster vaccine is?
No,
Have you any
doctor,
information
no.
about that?
No, doctor.
Basically, okay, I can tell you that basically this vaccine has uh, a combination of three medicines against three different germs and organisms. This is called diphtheria, tetanus, and uh, basically the three diseases against which the vaccine works. That is diphtheria, tetanus, and whooping cough. And basically, it is recommended for the adults which are going to in close contact with the newborn. Have you ever heard about these diseases?
No, doctor, I don't know. I haven't heard. Well, doctor, like you just said, it's got three different kind of diseases, diphtheria and all those things. I don't want to get myself that. I don't want to have this vaccination because, then I might get these diseases, I don't want that.
Okay, that's fine. That's fine. I can understand your concern. But the thing is, you are going to in close contact with a newborn, and these three diseases can make a lot of damage to the newborn if the newborn came in contact with any of these diseases. So I can tell you a little about details about these diseases. First of all, there's most concern is about the whooping cough. And the thing is that um, if any infant came close to the whooping cough, it can be fatal for that infant. Are you understanding my explanation?
Yes, doctor, I do understand that. I am following you. Well, doctor, like I don't really go out. I don't really go out, and the thing is that I don't go out. How am I going to get this disease anyway? I don't go out at all.
And the thing is that in old age, the immunity is also going low in some persons, but there is a chance that you are come in close contact with any of these diseases, and if it is transferred to you to the infant, he can face a lot of uh, complications like severe relentless coughing, hypoxia, and inflammation of the brain. This is called encephalopathy, and it can also lead to the brain damage. So it is recommended for the elderly person so that there may be no there may be no chance to get transfer any infection to the newborn. So and it's better for you to go for this vaccine, and it will help a lot in the good health of the infant also. Can you understand? And are you picking my point?
Yes, doctor. Yes, I do understand, and I do get your point. But the thing is, doctor, that okay, just give me the vaccine for pertussis. Then I don't want the other two.
And basically, the most of the infants they are become infected with the drink of, but and the other those two vaccines are also um, essential to save the infant from uh, these diseases. These are tetanus and diphtheria, and as it is a single dose vaccine, and it contains all of the medicine against these three diseases. So it's better to go for and these diseases on in the same time. So don't worry, please.
Okay,
You
all
don't
right,
have
all
to.
right, all right, all right. Dr. Mubashir, the time's up. Okay, the time's up. All right. Okay. So how do you think you did?
I have missed up one point. I should be a little more faster.
Okay, all right,
Hope
okay,
that
all right.
covered the point.
Okay,
And at the
so,
end,
mhm,
I
mhm,
should save a little time to re-summarize all
mhm, mhm. So my question here is, Dr. Mubashir, what if you miss the last point and what if you don't summarize? What would happen? Are they gonna not give you marks?
I'm not clear about that,
Okay,
but
let me tell
I
you
think
then.
that at least I
Mhm,
have covered
mhm,
all the points which they have.
mhm, mhm, mhm. That is good to know. Now, here's the thing. Let me just clear that for you. Number one. Number one is that they don't care if you haven't done the last task, right? Last task, right? It's necessary to like get at least to this point. Right, good to know, good to go. Right, there was a when I was taking my exam, there are lots of candidates who just reach up till here. Okay, they reach up till there, and then there are times like they have done everything and they still have got 2 minutes. So you can have both the situations. How do you deal with them? First, let me just give you a review of what you said. You said, hi, my name is Mubashir. Then you said, okay, can you tell me your name? Right, can you give me your info? Then you said, by the way, I'm Mubashir. All right, now this is first of all, see, we are this exam is just asking you to have a professional conversation, right? So professionally, I don't go about saying, hi, this is Dr. HWD, or by the way, this is Dr. HWD. No, a professional person would say, good morning, first of all, like a good greeting, right? You could say greetings or hello, or like morning or good afternoon or something like that, something professional, right? That's what you say. Then you would say, then you would tell your name in a proper way, right? Hi, this is Dr. whatever, or hi, my name is this and this. Or then you would take the name of the setting, right? I'm one of the doctors here in the clinic, all right? Very important to do that. After that, you said that like I said that I'm here for pertussis, and I said that my daughter was pregnant, right? Now even here it says that inquire the patient's daughter is going to have a baby. Anytime they tell you that somebody in their family has got a job, somebody is getting pregnant, somebody is getting married, somebody's got a new dog, they got a new ring, a car, you congratulate them. Somebody died, somebody has a disease, you say I'm sorry, right? Dr. Mubashir, are you following me? Yeah.
Yes, ma'am. Yes, ma'am.
Okay. First of all, you're very confident. That's a good thing, right? Then you said, have you in any info? No, 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 not have you. Do you have? Right? The grammar is important. Okay. Your
Okay.
English is good. You're confident, but you need to say, do you have any idea? Or do you have any information? Right? Then don't go about saying the whole thing again and again. Right? Then you said, that's fine. Right? Like the patient responded to you, and then you said, no, I don't know. Then you said, that's fine. But the thing is, right? Instead of just saying, but the thing is, or but the point is, because we're not doing an argument, right? We have to understand that when you talk to a patient, it's not an argument. We're just trying to make them understand. There's a difference between being an argument and having an argument, and making someone understand. Right now, we tend to make these two mixed up. That yeah, like there is no difference in making an argument and like discussing, but there is a vast difference. That when you discuss, you don't judge them, right? When you're
Okay.
argumentative, you judge them, right? Like, how did you judge the patient? You said, all right, that's fine, but the thing is, right, like, my point is what is valid. No, we're going to say, all right, I understand your situation, but this is what we recommend and this is how things go, right? Okay, now details about the third point you gave at the very end. And when you're telling them that the person can even die, now you're trying to make sure that they understand it. You're telling them something so severe. First of all, she told you that her baby, her daughter is going to have a baby, right? Now that's a big
Yeah.
news, right? You need to congratulate that. After that, you should say that I know that it can let me tell you that it can lead to coughing and hypoxic encephalopathy. Now this is a big term. They want to see if you can explain this. They're not idiots to put it here, right? They put it here because they want you to explain it. All right, Dr. Mubashir. Now you can say that it can
Yeah.
lead to decreased oxygen in the brain, right? Or even like
Okay.
just take the name and say that that's a complication of the brain. No need to necessarily explain it, but please take the keywords, right? There are certain keywords, right? Now, what is a keyword? Recommend, that's a keyword. Close context with newborn, that's a keyword. Relentless coughing, you said that, keyword. Encephalopathy, keyword, right? Vaccine is 3 in 1, keyword. Don't forget to take the keywords in. You have to tell them, because otherwise they think like you haven't followed the card. Even though you're explaining the things, but if you do not say the keyword, they'll say that you haven't followed the card, which is not the case, right? Because you read it. I saw you read. Yeah. Okay. then you were saying that may I give you some details about the problem, right? The thing is that I hope you understand, right? So make sure you use the keywords. So then you said that it's better for you that you do this. No, 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 we're not threatening them. Don't threaten them, don't put an argument, just make sure that you're talking to someone who is like a 3-year old, right? 3-year old. When you talk to a 3-year old, I know that in our cultures, Pakistan, India, Bangladesh, Turkey, China, Africa, we are very, tough on our patients, our children, and all that. But in other countries, there are rules and laws, so you have to go and abide by that. Dr. Mubashir, I just want to ask, why are you taking this exam, OET?
I'm basically, ma'am, I have already done MRCS ophthalmology,
Mm-hmm.
and
Mm-hmm.
I'm
Mm-hmm.
going to apply for DSP. Just I have to get my IELTS
Good,
or OET,
good.
and then I go
Mm-hmm.
for
Mm-hmm. Good, good, good. Now, when you're going to do your MRCP, you guys do have paces, right? You do have paces?
No, I no, ma'am. I have already done MRC ophthalmology, MRCS
Uh-huh,
ophthalmology
okay.
from
All right,
from
all right.
Edinburgh.
That's
So
good. That
I don't have to go for PLAB or MRCP. I have to apply for
is there. Mhm, mhm.
GMC, and then I can go for work.
That is good. That is good to know. So there, guys, this is another option for those who are looking for flap seats, right? So Dr. Mubashi, the thing is that when you're going to work there, they want to make sure that now OET. Why are they doing OET? They're doing OET because IELTS is more technical. There, the grammar matters. There were many grammatical mistakes, but those are overlooked in OET, right? Because they want to make sure that you are professionally correct to
Okay.
talk to someone, right? So just work on these mistakes and you'd be good to go, right? Okay.
Okay.
Make sure
Thank
you
you. Thank
respond
you.
with empathy. Make sure there is no reaction to your answer, right? Don't give them reactionary answers. Yeah, is it clear, Dr. Mubashir?
Okay.
Any
Yes, ma'am.
questions? Any questions?
No, ma'am. I think I am a little
Okay,
clear about that.
that is good to know. That is good to know. All right, Dr. Zeshan, again, it's your turn. All right, anybody else who have their exam, has their exam tomorrow? Because I'm just taking them today. Yes, anybody else? Dr. Iyas, Dr. Asad, Dr. Bibek? Okay. All right. So, Dr. Zishan, it's your turn again. Can you hear me?
Yes, ma'am.
Okay, good, good, good. Let's give you a card. Okay. Uh, just give me a minute because most of them are done. So, okay. Here's the thing. This is your card. You got 3 minutes. Prepare the card. Let me know when you're done. Okay. Your time starts now. All right, Dr. Zeshan, the time's up. Are you ready? Should we start?
Yes, ma'am.
Okay. All right. Please begin.
Good afternoon. I'm Dr. Zeshan. May I verify your name and age?
Yes, doctor. My name is John and I am 23 years old.
Thank you for verifying your name and age. I will be your treating doctor at general practice today. So I can see from my notes that last week you presented with the feeling of tiredness and you had a problem to go to sleep. And you told me that your exams are upcoming. So you were worried about your exams. So on physical examination, there was no signs of anything like depression. So I ordered some tests. So today I received the reports of the test. So reports are normal. Uh, Mr. John, are you following me?
Yes, doctor. Then why am I feeling so tired?
Uh, I can see that you are worried regarding your symptoms, but let me reassure you that there is uh, no medical problem that you are having right now. Uh, l- Let me explain for you that your exams are coming and there might be a stress factor that are causing the problem related to your sleep. I hope you are following me.
Yes, doctor, I am. But the thing is, doctor, that there should be the reason. And you know what? My exams are in 2 weeks, and I just want I want a medical certificate. Please write me a medical certificate because I have to make sure that I get better soon, and that's what I'm here for. Yeah.
I can see that you are worried regarding your sleeping and other symptoms. But let me reassure you that you are not having any problem. So I would highly recommend you some other things for your sleep, like you should do some exercise and avoid some
I exercise,
coffee.
doctor. I exercise. Yeah. Mm-hmm.
Oh,
Mm-hmm.
that's great. I really appreciate that. I would like to just ask some other questions. Uh,
Mm-hmm.
so how about are you taking any caffeine or coffee, like these kind of
Yes.
things?
Yes, I do. Yes.
So, so I will highly recommend you that you should stop taking these things at least at night. I know it's a
Mm-hmm.
difficult for you, but I will highly recommend you. Uh,
Mm-hmm.
Please avoid these things at night. I
Mm-hmm.
hope you are following me.
Yes, doctor, I am following you. I do
So,
understand
and a
that.
medical certificate, and
Mhm.
as you asked me for a medical certificate, with these symptoms that you are not having any problems. So really, with apology, I will not be able to uh, prescribe a medical certificate for you in the future. So I'm really sorry for that. So if I would like to ask some question, if you don't mind,
Yeah, please ask. Yes.
do you have any concerns regarding your exams?
Well, doctor, our exams just make me really bad. Like I've got my exam tomorrow and one exam tomorrow, and like I'm very worried. I don't know how I'm gonna do. And please, doctor, just write me a medical certificate. I just need that. Please, just give me a medical certificate.
I can see that you are worried. We all have been going through these exams. These exams are really stressful, and I can understand what's the situation you are going through right now. Uh, but for medical certificates, sorry, with apologies, I will not be able to do that. And as I have given some information regarding that you need to quit stimulants like coffee and other caffeine things. So I hope you will follow my recommendation and you will come back next week. So we will review again. I hope
Okay.
you are
All
following
right.
me.
Yes. Okay.
Anything
Okay.
else you want to ask?
The time's up. The time's up. Okay.
Thank you so much.
All right, Dr. Zeshan. First of all, it was very, very good. You have kind of improved in just one go. So now you just did one big mistake. That was that when a person comes back for the results, right? As you can see that you've seen this person before, right? And they've come back for result.
Yes.
So before you just explain them the results, how about you ask them that I remember you came in for because you were having some difficulty in getting sleep, as it says over here, right? It says over
Yes.
here that this person was having difficulty in getting sleep, stressed over upcoming exams, and no symptoms, not clinically depressed, right? That's what you were having. So how are things now? Have they improved? First ask them, because he came a week ago. How about now? Maybe
Yes.
it's improved
Yes.
or it's got worse, right? So
Yes.
first ask them. Then the patient would be like, no
Okay.
or yes, and you'd say, well, because you are having nothing, and we got the blood test, but unfortunately there is nothing wrong in them, right? Instead of saying, you're not mad, or when a person comes to you, they are usually, why does a patient come to you? Because they're looking for help, they're looking for empathy, they're looking for sympathy, they're looking for someone to talk to, right? Most of the times. And what do we do in our cultures in Pakistan, India, and Bangladesh, and all these sort of cities and countries? We just call them as functional patients, right? Like they've got some chasms, they're
Yes.
just seeking support. But that's not true. There is a cause. Now, what's the cause here? The cause is that this person is, you didn't ask them. You didn't ask them, right? That you didn't ask them that, how is your sleep? Before you recommend them that, you need to do
Yes.
gentle exercise, you need to ask them, what if he's exercising, right? You did good that I told
Yes.
you and I gave you when you picked up on this. But before you suggest someone something, I say this same thing all the time to my students who are with me. And I think I've taught this to Dr. Moss too. And someone who's around, like that, I don't know you. And if I say that, stop driving or stop smoking, stop drinking beer, you'd be like, ma'am, I don't do that. You
Regarding.
should ask me before you tell me that. So,
Yes. Yes, ma'am.
this is the thing. This is the thing that before you
You
suggest, and this should be the rule in life, that before you suggest someone something,
you should
first
ask
ask
first.
them. First ask them. Secondly, see if they really need your suggestion, right? Okay, suggestions or advices, the ones that are unwelcomed, unasked for, are never appreciated. Yeah, but this is a cultural problem. Okay, so make sure that you ask them. Okay, so do
Okay,
ask them,
ma'am.
right? Before you recommend something, right?
Okay.
Like it says the word suggest, ask them, right? Then you told them that, we cannot, I'm apologizing, I'm really sorry, I cannot do that. No, 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 no. You have to be professional. You'd say that, like what would happen if you write him a medical certificate? What do you think would happen if you write him a medical certificate?
It will be illegal against our
Yeah, yeah, good.
practice.
You'd say, I know that you're very concerned and you're worried for your exams, but it would be illegal, right?
Yes, ma'am.
Mm-hmm.